We're diving deep into the incredible work of Dr. Sara Gottfried, and we're basically creating a powerful visual blueprint for your hormonal health based on her expert insights. The idea here is that the unique biology of a woman's body, well, it comes with its own set of health challenges that, let's be honest, often get overlooked or just completely dismissed. This is how much more often women suffer from digestive issues compared to men, more than 10 times. So why should you care about that? Well, because your gut is a massive indicator of your overall health, and as we're about to see, it is deeply, deeply connected to your hormones. Okay, so how do we even begin to tackle these challenges? It all starts with a pretty fundamental shift in how we think. We have to stop looking at our bodies as just a collection of separate parts. Now, this is what's so interesting. Look at the old model versus the new. The traditional way is totally siloed, right? You've got constipation, you go to a gastroenterologist. You're feeling tired all the time, you see an endocrinologist. It's all about just slapping a Band-Aid on isolated symptoms. Dr. Gottfried's whole argument is for a network model, one that actually looks for the root cause of what's going on. And this is that network. It's what she calls the PINE system, psycho, immuno, neuro, endocrine. It's this mind-blowing idea that your thoughts, your immune system, your brain, and your hormones are all talking to each other all the time. It's one big interconnected control system. So the stress you feel, that affects your gut. And your gut, that in turn affects your hormones. It's all one conversation. Okay, so now that we have this network view in mind, the first real practical step is to understand your own personal hormonal landscape. It's all about creating your own health blueprint. Dr. Gottfried uses this fantastic analogy, and I love it. Think of your two main hormones, estrogen and progesterone, doing a tango. Estrogen leads, progesterone follows. And for a healthy, beautiful dance, you need them to be in balance. But what happens way too often is that estrogen starts to dominate. It leads the dance way too aggressively, and that can ramp up the risk for things like fibroids and breast pain. So you might be asking, what's actually influencing this tango? Well, a huge, huge factor is your gut. Specifically, this collection of microbes she calls the estrobolome. Think of it like a little community of bacteria living in your gut, and their job is to regulate your estrogen. They can either help you get rid of the excess, or they can cause it to recirculate. Dr. Gottfried has this great line. She says it's like bad karma. All right, to really get a clear picture of your personal blueprint, you need data. You have to test. This slide lays out the key baseline biomarkers Dr. Gottfried recommends. And here's a crucial tip. For women who are still menstruating, testing estrogen and progesterone around day 21 or 22 of your cycle is absolutely key. The big idea is to establish this baseline when you're younger, say in your 20s or 30s, so you have a personal reference point for your entire life. Okay, let's switch gears and talk about something that is so important, but is hardly ever discussed in a meaningful way: the massive biological changes that happen in a woman's brain during that transition to menopause. You hear this all the time, right? Women hitting their 40s start talking about brain fog. They feel slower, they can't find their words, they're not as sharp. But what is actually going on inside the brain? This isn't just a feeling, you guys. It is a measurable biological event. And this slide, honestly, this is stunning. Research from brilliant minds like Dr. Lisa Moscone shows that on average, there's a 20% drop in the brain's ability to use glucose for fuel during the perimenopausal transition. Dr. Gottfried calls this slow brain energy, and it's the real biological reason behind that feeling of brain fog. And this right here is a major, major reframe. We're all taught to think of things like hot flashes and night sweats as just these annoying symptoms you have to suck it up and get through. But they're not. They are critical signals. Biomarkers, really, coming straight from your brain, telling you that some significant shifts are happening in your cardiovascular and metabolic systems. We have to start listening to them. So, knowing all of this, the big question is, what can you actually do about it? What are the most powerful levers you can pull to take back control and start building a blueprint for health that lasts a lifetime? Okay, first lever, stress. But there's a really important distinction here. It's not about getting rid of all your stress. I mean, that's impossible, right? It's about lowering your perceived stress. It's your body's physiological reaction to what's happening. That's the part you can control. And that's what directly messes with your cortisol levels and can throw that whole hormonal tango completely out of whack. Next up, let's talk about exercise. It's time to reevaluate how you move. A lot of women default to what Dr. Gottfried calls chronic cardio, which can actually jack up your cortisol. Not what we want. Instead, she recommends this specific ratio. For every 1 session of cardio you do, you should be doing 2 sessions of resistance training. That blend is just optimal for supporting your metabolic health and muscle mass, which are both absolutely crucial for keeping your hormones balanced. And finally, here are some really accessible, high-impact levers you can pull starting today. First, adopt a food-first philosophy. Really think about what you're eating. Then, prioritize magnesium. It's wild, but something like 70 to 80% of us are deficient. You need to know your numbers, so get a CAC score. That's a coronary artery calcium score to check in on your heart risk. Understand your ACEs score, which is all about how adverse childhood experiences can impact your health down the road. And finally, she urges women to critically think about incessant ovulation and to reevaluate the long-term default use of oral contraceptives. So when you boil it all down, here's the crucial point. Your body is constantly sending you signals. From constipation to brain fog to hot flashes, it's talking to you. The big takeaway from Dr. Gottfried's work is this. It's time to stop being a passive patient who just manages symptoms. It's time to become the active architect of your own health, someone who's equipped with the knowledge to read those signals and build a blueprint to respond.